Hello students and welcome. This is Professor Horvath. In prior lectures we have covered the concept of left-sided heart failure. In this lecture we will be covering the concept of right-sided heart failure. First, we are going to review the functions of the ventricles. Second, we will define what right-sided heart failure is. And finally, we will discuss the causes of right-sided heart failure. Let's get started. In reviewing our basic anatomy, it is important to remember after the ventricles fill, it is their job to pump the blood volume forward in the circulatory system. As you can see by our illustration, the left ventricle pumps its blood volume into the systemic circulation and is responsible for cardiac output and therefore tissue perfusion. The right ventricle pumps its blood volume into the pulmonary circulatory system and is responsible for gas exchange and ultimately providing the volume for filling the left ventricle. One of the ways heart failure is classified is as either left or right-sided ventricular failure. In right ventricular failure, the right ventricle fails to adequately pump blood to the pulmonary circulatory system. This interferes with gas exchange in the alveoli and ultimately leads to decreased filling volume of the left ventricle. It also results in backflow of volume to veins, tissues, and organs. The most common cause of right-sided heart failure is actually left-sided heart failure. When the left ventricle fails to pump efficiently, there is a backflow of blood into the pulmonary circulatory system. This increases the pressure in the pulmonary circulatory system, which is usually a very low pressure system. The right ventricular pump is not designed to pump against a high pressure system. Over time, this increased ventricular workload damages and weakens the right side of the heart, which then also loses pumping power. Other cardiac causes of right-sided heart failure include coronary artery disease. This can directly cause right-sided heart failure by blocking blood supply to the right ventricle. Right ventricular infarction. This damages the muscle tissue, and we all know, of course, that the muscle tissue is, of course, the pump. Pulmonary or tricuspid valvular disease. Regurgitation or stenosis of either of these valves causes backup of blood flow, which increases pulmonary circulatory volume and pressure. This causes enlargement of the right ventricle and results in right ventricular failure. Pericardial constriction. Repeated or ongoing inflammation of the pericardial space causes it to stiffen and thicken and prevents the heart from filling and pumping normally. Congenital heart disease with left to right shunt. This is an abnormal connection between the left and right side of the heart that causes a volume overload of the right ventricle, and this leads to right ventricular failure. Pulmonary thromboembolism. A pulmonary embolism, a PE, results in an abrupt vascular occlusion, which increases the pulmonary circulatory pressure within minutes to hours, and this causes immediate right ventricular injury. Pulmonary hypertension can be caused by COPD, which is chronic obstructive pulmonary disease, or emphysema. And if any intrinsic or acquired pulmonary disease are the cause of pulmonary hypertension that causes the right ventricle to fail, it is known as cor pulmonale. So to review, in this lecture, we have reviewed the functions of the ventricles. We have defined right-sided heart failure and its causes. Remember that with right-sided heart failure, we have decreased pulmonary tissue perfusion, which leads to impaired gas exchange. Also, the decreased blood volume moving forward leads to decreased left ventricular blood volume. This decreases cardiac output and ultimately systemic tissue perfusion. These all translate into the signs and symptoms we will see in our patient assessment. That is all for this lecture on right-sided heart failure. Please complete your assignment and I will see you in class. If there are any questions about right-sided heart failure, or if you have questions about any of your material, please contact me using my contact information that is located in the course syllabus. Thank you, and I look forward to our next lesson together.